A very good morning to one and all. So in today's class we are going to discuss about tuberculosis. So as we all know, tuberculosis is the deadliest disease on the planet. It has been declared as the very deadliest disease once it is left untreated or unnoticed, which may end in deadliest result. So the World Health Organization has declared that up to 2015 TB is the most deadliest disease, even it is worse than Ebola virus, malaria or even HIV. So what is tuberculosis? So it is, as we saw, it is said to be a very deadliest one, but what it is exactly? So tuberculosis is a disease caused by tiny germs that enter into your lungs when you breathe them in. So it is a contagious virus which enters in through the breath of a human when it comes in contact with a human nasal system. So TB germs are most commonly found in the lungs, but as many of us don't know, it may also move to any parts of our body. So one may get, which means one may get tuberculosis in any part of our body, even in your face or neck or hands or anywhere, even in uterus. In any part of your body. It is not only meant for the lungs. Most common organ which gets affected with the tuberculosis is the lungs. So when you have TB, this is on the lungs, it can spread it to the other people also. So once it is engulfed by an individual, he may be the transitor of the disease from him to another person. It is a contagious disease. So tuberculosis, the bacteria remain in the body in an inactive state, that is latent tuberculosis. There are, we can tell it as a types of tuberculosis. One is latent, another one is active. So the latent tuberculosis is a bacteria which remains in your body, but it will be in an inactive state. It causes no symptom and there are not contagious too, but they can become active at any point of your time. Which is called as a latent TB, which is latent tuberculosis. Another one is active tuberculosis. The bacteria do cause symptoms and it can be transmitted from one to another. It is highly contagious and it leaves very sensitive symptoms in your body. What may be the causes of tuberculosis? So tuberculosis, as I told in the first slide, it has been spread when you come in contact. It's been spread by the respiratory system. When you breathe in the tuberculosis germs, it will get injected, it will get engulfed in your body and it will spread to any part of your body. So the major organism or germ which causes tuberculosis is Mycobacterium tuberculosis. If it is a bacteria, all the other thing causes tuberculosis are listed. Any other 4 types of Mycobacterium species also causes tuberculosis. And then the members of Mycobacterium tuberculosis species also in complex with any other hyperactive bacterium, Mycobacterium, may end up in having tuberculosis in an individual's body. But the main cause of tuberculosis is the Mycobacterium tuberculosis. Okay, so once it is the Mycobacterium tuberculosis enters in an individual's body, he will get affected, but how it will get spread, that is what we are going to discuss in the next slide. So how is a TB spread? Once you get it ingested in your body, once you get the germs ingested in your body, when you cough or when you expel your mucus in any form, others if coming in contact with the cough or through the air or the germs will get into the person who are in contact with us also. That is how it is spread, and one way is it will get circulated in the air through the cough and it will spread to another person. Another one is a spilling of the mucus or expelling the mucus, infected mucus, and when it comes in contact with the person, that also may create. This expelled mucus will have the germs in it which will get mixed with the air, and that also can cause TB to another person. So what are the clinical features of a TB? Once the germ is ingested, what are the features it will cause? What are the effect it will cause on your body? That's what we are going to discuss now. So it is wasting of tissue. The person who are suffering from TB, who have just got ingested with the TB germs, will have wasting of tissue in enormous state. So they will be probably very underweight, and people who have primary complex are also suspected to have TB, they also will be in a very underweight state. Exhaustion. Exhaustion is nothing but the person will be in an absolute tired for no reason. Even for doing very simple work, they will be getting tired very easily. And cough. One of the major symptom and notorious symptom you can see among the TB patients is the cough, and particularly whooping cough. That is nothing but we call it as a continuous coughing for without a break. It will be last for 10 to 20 minutes also in some person. Expectoration, which is cough with expelling mucus secretion, respiratory secretion such as mucus or blood in the mucal area, something like that. And then fever. They will be having high fever, especially fever in the night time, persistent fever which lasts for a very longer period, and then the fever with very high temperature, chilling fever. Everything may be the clinical feature of the TB patient. And acute phase resemblance pneumonia. This is nothing but the patient suffering from tuberculosis, sometimes they may end up in having pneumonia, that is the short time pneumonial attack, which may result in having a very severe acute pneumonia in their lungs. And chronic phase may have very low degree fever which longs for a very long period of time. They will be in the fever will be treated once it is the fever will be gone once it is treated with paracetamol or some medications, but again once the dosage is over, it will again, the temperature will again rise. What are the other common symptoms of TB? So the TB, any patients who suspect to have TB will have the symptom of cough for 2 to 3 weeks of time or even more than that, continuous cough and coughing up blood. This is the coughing of blood means the patient on continuous coughing may end up in having blood in their mucal when it is expelled. Chest pains, severe cough end up in having chest pain to some extent. Fever, which I told earlier, fever will be a common symptom. They will have fever, and that too a long, persistent and long fever. Night sweats, they will be having severe. On the contrarily, with the fever, they also have sweats at the night time. Feeling very weak and tired, they feel always fatigued like an anemic patient. They always feel tired and weak they feel very fragile. Losing weight without trying. They lose, the abnormal losing of weight will be there in the case of TB, and decreased or no appetite. The TB patient, one of the major problems the dietitians deal with the TB patients during the time of recovery is the patients will have no appetite or very altered and decreased appetite, which ends up in having very less amount of intake that leads to improper supply of nutrients to them. And tuberculosis, these are the symptoms. You will have fever, chest pain, chills at the night, shivering, sweaty nights, weight loss, will be very tired and fatigued. You don't feel like eating anything, loss of, in very some cases, they may have no sense of smells also in very few cases. So what are the infectionable sites? What are the sites you can get TB in your body? So as we all know, as we all think, we think TB comes only in lungs, but contrarily what we know, TB is a germ which is an infectionable bacteria which causes damage to any part of your body. The topmost area which gets affected with the tuberculosis bacteria is lungs, and you also may get it in lymph nodes, skin, meninges, renal tract, hepatic and GI tract, bone, and even in the reproductive system or even in the eye. I personally know a patient having TB in her uterus. So another one I know, they have TB in their eyes. in his eyes. The patient who has TB in reproductive area, that is in her uterus, she got it treated. We found it, we diagnosed it very earlier. She got it treated with the course of medicines and all. So, but to know that TB will attack any part of your body. So, this is the thing we are knowing about the TB. In this class we learnt about TB introduction and spreading sites, infectionable sites of TB, the causes and the spreading of TB, and also the way of symptoms and other clinical features of TB. So, in the next class we will be seeing about the prognosis, diagnosis, prognosis and the treatment with the dietary modifications and all. So, thank you very much for the listening. Thank you.